So part of the process for deprescribing, we envisage it as a continuous cycle. And obviously the first element of it is just to consider the patient who you have in front of you and whether they might be suitable for the deprescribing process. Stage 2 is to obtain a really detailed medical history and a medication history so that you're very familiar with what the individual medications are for, what the goals and endpoints they're designed to treat, and also make sure you know about all the medications, both prescribed and unprescribed, including over-the-counter or over-the-fence medications that people may be taking. Once you've done that, it's important to then identify what are the principal targets that you want to address of the drugs available. Are there some drugs which are particularly dangerous? Are there some drugs which are particularly useless? And for other drugs, are they still appropriate? Once you've done that, you can design a hierarchy, and the hierarchy is designed to pick out which drugs are, in your opinion, the most important ones to try and get rid of first. And we'd always suggest that you think about one drug at a time rather than confusing the issue by stopping multiple drugs. So the next stage is to develop a plan, and that plan needs to be a detailed withdrawal plan so that you can then circulate that to other doctors or other professionals who are involved with the patient's care. And that plan needs to be one which the patient is endorsing, that their carers, their relatives are involved, feel comfortable about. Having done that, it's important to actually document what you're doing. It's also important to monitor the response to medication withdrawal, because obviously the information you have is just as important as information about potential adverse effects to a new drug you may introduce. If you stop something and there's a catastrophic result, then if nobody knows, then that needs to be clearly documented and available for people in the future. And finally, we want to close the circle by considering the patient and perhaps their response to what you've done, but also perhaps their changed circumstances. So if somebody has gone on to hemodialysis, for instance, their treatment plan may be different from when they're in just end-stage renal failure and not on active treatment. So we regard this as a virtuous circle, one which you can repeat both to make sure that you get it right with the individual drug, but also moving on to another cycle of the process when you're considering perhaps another drug that you may be wanting to get rid of, or indeed you may want to replicate the process at some time in the future when perhaps circumstances have changed.